With that knowledge, how is it that you help your patients with high cholesterol? How do you treat them? I mean, in general, what are some basic concepts that you help them to understand about inflammation?
Well, what we want actually is an anti-inflammatory approach, because the truth is that inflammation underlies all our chronic diseases, not just heart disease, cancer, diabetes, stroke, arthritis. I mean, inflammation is essentially what drives disease. If we could get rid of inflammation, we would get rid of 90% of our disease. And so my approach is to create an anti-inflammatory environment. Now, it's the safest way, it's the most cost-effective way, it's also the hardest way. People have to change how they eat, they have to learn to exercise appropriately, they have to learn how to handle stress and learn some relaxation techniques. And they have to make sure they have social and emotional support, the people who care about them, friends and family. By and large, in our lives, we tend to do what we've always done. And we eat the way we've always eaten. And since physicians have literally never been trained much in nutrition, I had no nutrition training whatsoever. I think now perhaps medical schools give a little bit, but essentially physicians don't really know how to guide patients in telling them what to eat. And I feel very strongly about the doctor-patient relationship. When I see patients, I do fee-for-service so that I can spend as much time as I want to with patients. I'm not limited by how much insurance is going to pay me, so I have to get it all in a 6-minute visit or a 10-minute visit. And I find that you can't just hand somebody a slip that says, here's a diet I'd like you to follow, and I want you to start exercising and learn to relax. Because if it were that easy, we'd all be doing it, and yet we're not. You know, I mean, the issue in this country of obesity is very severe. And so I find what you have to do is you've got to spend time with patients. And you can't do it in the climate that we have now where insurance doesn't pay very much, so physicians don't spend much time. And so what I do is time intensive. We do a lot of brainstorming because it doesn't do any good to tell a patient what to do. You've got to find out the milieu the patient lives in. You've got to find out what options do they have available to them. And for instance, it wouldn't do me any good to tell somebody, I want you to walk every day, if they don't live in a safe neighborhood. I mean, you know, nobody's going to go walk if they might get mugged. And, you know, it won't do me any good to tell people to eat organic food if they can barely afford food, period. So it is very important in terms of teaching patients what an anti-inflammatory diet is, which is another whole topic. But you know, it's kind of like a modified Mediterranean diet is an anti-inflammatory diet. But teaching them an anti-inflammatory diet and then working with them to see if they can do it. Like I said, it's one thing to tell someone what you would like them to do or what could benefit them. Then they have to come back and then they let you know how they did or they didn't do. And then you can brainstorm. Obviously, if it were easy to change the way we eat, we would not have the obesity issue we have. And the obesity issue is very severe. But, you know, learning to eat healthfully, learning to exercise regularly, and that's an hour of exercise a day. Now, I understand an hour of exercise because I work. So I go to work in the morning, and I don't get out before 6 o'clock. So I go home, you know, I change my clothes, I get the mail, you know, I have dinner, and I need to find an hour's worth of exercise. Now, fortunately, in my basement, I have a treadmill, and I have a recumbent exercise bike, and I have a Nautilus, and I have an exercise mat. And after dinner, I go down cellar and I do my exercise. And everybody says, after dinner? And I go, it's the only time available. And when you get a pattern established, you keep doing it. And so what I look with patients is to find patterns they can get established. And I also look to find things that they really like. Nobody will stay with an exercise program that they hate. So the idea is, first of all, getting to know patients and find out what their belief systems, what they have available, what options, what they'd consider, what they like to do, and also to let them know that you care about them. I think it's very important that people tend to make changes for people that care about them. I oftentimes say that one of the best ways to get people to change their lifestyles to have them fall in love. And did you ever find people, either they divorced or they're having a new relationship, and oh, they're so starstruck, and they start working out, they're careful what they eat, they trim down, and they get nice and slim and good shape. It's because of that love. Mm-hmm. And I feel the same way with the doctor-patient relationship. I always say you can't take care of people you don't care about.
Right.
And so I think it's very important to actually love your patients. In fact, we give our patients healing hugs. Everybody gets a healing hug unless they don't want one. But I think it's important to connect so that patients know you care about them.
Right. That
they're more likely to make changes if they're cared about.
And do you find that as a holistic practitioner that people are looking for a replacement for the statin drug? So they'll say, oh, well, I don't want to take drugs anymore. I'd rather take nutritional supplements, so I'll go see a naturopathic doctor or someone holistic, but they're still not willing to quit smoking or you know, change their habits. So first of all, you're trying to understand your patients so that you can help them come to a place where they're going to be ready and to decide for themselves the right lifestyle changes that will create a health process in their body and reverse a disease process. But do you find that most people will come to you and they just really want another type of pill, something natural?
Yeah. That's very common. Actually, patients exactly that come to me because they don't want to take drugs anymore. And I'm very careful to explain to them that, first of all, drugs are much more powerful than the natural things that we have. It isn't that natural things don't work, because they do. They're not going to be nearly as strong as drugs. And so it's important for them to understand that if they're on medication to lower their blood pressure, I'm not going to be able to just take them off their medication and put them on a supplement and have the same result. The approach I take is, if you don't make the lifestyle changes, then you're probably not going to come off drugs.
Right.
If you want to come off drugs, you need to make the lifestyle changes. Now, life is all about choices. And a long, miserable life is not more desirable than a shorter, happier one. And people should be given the opportunity to say, it's just not worth it to me. You know, I mean, smoking is, of course, a particularly difficult thing for patients who are addicted to it. I don't have many patients who have continued to smoke, but I do have a very small handful. And it's very hard for them to stop. And I have one who said, I'd rather die. Mm-hmm. It's not for me to moralize. It's not for me to say how you have to live your life. I know what I do for myself, but that's for me.
Right.
And it's important to create a scenario so you can work with everybody no matter what. If somebody's going to continue smoking, it doesn't mean I'm not going to care about them. It doesn't mean I don't like them. It doesn't mean I won't help them clean up other risk factors. The likelihood is, though, if they don't change their lifestyle enough, they will not be able to come off drugs